And the other thing that we have seen over the last, particularly the last few weeks, is we're seeing the epidemic move from originally Mangina, that I mentioned before, to Beni here, and then further south to the major city of Butembo, where it was extremely difficult, but good progress has been made. We hardly have any cases there, but in the meantime moved back into Mangina and Beni. So that cycle also has to stop. We need to protect our gains and then push forward in those areas that remain so that we can bring this to an end. And that goes to the third point I want to highlight that I think will be essential in the new strategy, and that is to review all the basics of how to control Ebola. We have new technologies, the vaccines have been extremely helpful in limiting the response, but the basics are still important, and the basics include good surveillance, good contact identification from an Ebola patient, tracking those same individuals to see if they develop the symptoms, and if they do, testing and isolation if they are actually positive. That's the way that you break this epidemic. And if you can apply that strictly, we can bring this to an end quickly. So we need to review where those weaknesses are as well. So we have many challenges, I think, ahead. It's not going to be easy. We had a recent case in Goma, in which it looks like there's more than one individual that has been that's infected. It's a stark reminder that as long as it circulates in this area, it can move into a new area like Goma. We had a case that crossed into Uganda. We had another case that was close to the border with South Sudan. And the longer it continues to circulate in this area, the more likely we'll see a chain of transmission established in another part of this country or a neighboring country.
That without access to communities, all the public health techniques and tools we have are useless. If we have one person who doesn't trust, who decides that they need to hide their illness because they are frightened of us, they think we are not people that they trust, and they do not believe that we're people there to do good. If that person hides, that person goes to another area, infects another area, the epidemic continues. So all the work that Mr. Gressly has been talking about, increasing the support for better security so that the public health teams can go in, but also building trust with communities, demonstrating to the community here that we are actually here for good and for a useful purpose. That we feel will make a difference. Also, placing our teams as close as possible to wherever the infection is burning so that we are close to community. And Mr. Gressly described the camp we have way out in the forest where the staff are all working, staff in all sorts of disciplines, so that the work can be done at community level and the community knows us and knows that we are there to do what we all want to do, make a difference and stop this outbreak.